Well, Dr. Gladys is our speaker today, and she is the founder and CEO of Conservation Through Public Health, an award-winning NGO that protects endangered gorillas and other wildlife through One Health approaches. After graduating from the Royal Veterinary College, University of London in 1996, she established Uganda Wildlife Authority's first veterinary department. In 2000, she did a zoological medicine residency and master in specialized veterinary medicine at North Carolina Zoological Park and NC State University, where master's research on disease at the human-wildlife-livestock interface led her to found CTPH, or Conservation Through Public Health, in 2003. In 2015, she founded Gorilla Conservation Coffee to support farmers living around habitats where gorillas are found. CTPH's most recent award is the 2020 St. Andrews Prize for the Environment. Dr. Gladys is a National Geographic Explorer and winner of the 2009 Whitley Gold Award and 2018 Sierra Club Earth Care Award and 2017 Golden Jubilee Medal from the President of Uganda. In 2020, she was awarded the Uganda Veterinary Association World Veterinary Day Award and Aldo Leopold Award for mammalogists. In 2021, she was recognized by Advanced Media among 100 most influential women in Africa and recently won the UNEP Champions of the Earth Award in the category of Science and Innovation. She is the current chairperson of the Africa chapter of the Explorers Club, on the Leadership Council of the Women for the Environment in Africa, and vice president of the African Primatological Society. She has recently been appointed to the World Health Organization Special Advisory Group for the Origin of Novel Pathogens. So with all of that, I'm very excited to introduce Dr. Gladys Kalema-Zikusoka.
Thank you. My presentation is quite long, but I'm going to go through it very quickly because I know that I just have half an hour. I think I was told. And I've been working with mountain gorillas for a long time, as many as 25 years, actually, starting off as the first full-time wildlife vet for the Uganda Wildlife Authority. And I became an Ashoka Fellow for merging Uganda's wildlife management and rural public health programs to create common resources for both people and animals. I was very excited to, I was very excited to become a UNEP Champion of the Earth Award in Science and Innovation. And being that this has all been organized by the One Health Initiative of Tennessee, it's fantastic that One Health approaches are being seen as very viable, even for conservation and sustainable development. Because the year before me, the person who also won this award was someone who does a lot of One Health work. He's a colleague of mine based in Germany. He was working at the Robert Koch Institute and recently launched a new One Health Institute called the Helmholtz One Health Institute in Germany. So it's exciting that when we started this approach over 20 years ago, everyone thought we were strange, but it's good that now everyone else is beginning to recognize that it has value. Probably the COVID pandemic has made it possible, but at least people are beginning to understand why you should integrate human, animal, and environmental health together. I'm excited to be on the WHO Special Advisory Group for the Origin of Novel Pathogens. And I probably, on that group, there are 4 vets, and the rest of them are public health experts, and one person works with bats. But there's an increased recognition that we all have to work together in order to achieve a common goal, to have a healthy planet. And last month, I was given the Edinburgh Medal Award for our work in planetary health, which is great. I first got involved in primate conservation through research. When I was a vet student at the Royal Vet College, University of London, I got an opportunity to study chimpanzees and gorillas during the holidays. And I went and worked in Budongo Forest first with Professor Vernon Reynolds, studying intestinal helminth parasites. 2 years later, I got a chance to go to Bwindi to study the mountain gorillas. And that time, gorilla tourism had just begun, so it was a very exciting time to be there, and I was at the tourist site. This photograph was taken when I had gone for a walk to the waterfalls, because as soon as I got to Bwindi, unfortunately, I had a very bad cold, which was really sad, so I couldn't go anywhere near the gorillas. This was in 1994. And I couldn't go anywhere until I got better. But luckily, I could take my sample pots to the rangers, train them how to collect the samples I needed until I got better after 1 week, and I could go. And there was no health centers anywhere nearby, so I couldn't even go to get any, antibiotic treatment or anything to speed up the process. I just had to get better naturally. But by the end of it, I realized how we can be a big problem for the great apes if we are sick. Because when I finally got to see them, we really got close. And that was the reason why I was hired as the first veterinarian for the Uganda Wildlife Authority, because gorilla tourism had just begun. And 2 years later, in '96, I was the first vet. And they thought that tourists could bring a fatal flu such as COVID-19. So it was very important to have someone on board who can make sure that the gorillas are healthy and, so we can protect this important resource. That time, there were only 600 mountain gorillas, about 600. This one's one of my favorite ones called Kanyonyi. And the two populations, the Virunga population had been counted. There were about 300 here, 350 here. Bwindi was just an estimate, but in '97, a year after I started working officially as the first vet for the Wildlife Authority, I got involved in the first gorilla census, and we were able to count 300 gorillas. So it was then confirmed that there's 650 mountain gorillas left in the whole world. And during that time, the biggest threats to the gorillas, which haven't really changed, unfortunately, is habitat loss. In fact, it probably could be getting worse because people were not allowed to enter the park anymore when it became a national park, but the gorillas come out because now they're more habituated, they're more used to people, and they went back to where they used to range before the gorilla tourism began and before people had cut right up to the edge of the park. So people are always coming out of the park. Gorillas are always coming out. People can only go in as tourists or researchers or vets or, in controlled fashion, but there's poaching, and it's not poaching for gorillas in Uganda. It's more of poaching for duiker, bush pig, and other species, and they accidentally get caught in snares. We did have a casualty also during the pandemic. One of the first diseases I've had to handle as a first vet for the Wildlife Authority was scabies. You may think that scabies is not such an important disease because it doesn't affect people so badly, but this baby gorilla died of it because gorillas are naive hosts, and this mite came from a closely related host, a human being. We share over 98% genetic material and can easily make each other sick. So the baby gorilla died, and the rest only recovered with treatment. We treated them with ivermectin. Thankfully, they all recovered, but it was eventually traced to people living around the park who had very little health care. These little boys were supposed to be in school, but they were herding goats, and they obviously were not bathing that often. And as long as you have a lot of people living next to the park who are so poor and unhealthy and hygienic, the wildlife is always going to be compromised, especially the great apes. This is a typical scenario where gorillas go and eat the banana stem. Actually, they're more interested in the stem than the fruit because they're looking for moisture, and they actually have a very large, they mainly eat leaves, shoots, and stems. So this annoys the farmers even more, the people living around the park even more. And I asked this particular person whose crop was destroyed, do you think the gorillas are important? He said, yes. Since it became a national park, they hire most people from the community. And he said, some of the money from tourism revenue goes to support our community, the villages around, but the individual farmer like me, whose crops get destroyed, I'm not compensated. So I spoke to my bosses about it, and he was one of the first people who joined the Human Gorilla Conflict Resolution team when it was created, of local community members to safely herd gorillas back when they come out. But Bwindi Forest is also important for water. It's a very important source of water source for the area. As long as you have the forest intact, it modulates the climate. There will be lots of rain. It rains quite a lot there, which is great. And so my husband's a founder member of Conservation through Public Health, and he managed to convince UNIDO and GIZ to put a micro hydro dam for the communities. And so people are now, some areas are able to get electricity because during this time, the electric grid did not even get to this part of Bwindi. But the gorillas like to play here, and they can also get in contact with human waste. We've also had cases when we don't even know if it's human related or not. This particular gorilla had a rectal prolapse, and we weren't sure whether she got it when she was training to defecate, and she picked up a human parasite, which caused her to strain to defecate, and the prolapse came out and stayed out. But anyway, after I operated on her, she recovered, and we realized that we needed to set up an early warning system for disease outbreaks to know what they have when they're normal, so that when they're abnormal, we're better able to know what has caused the disease. So all of this resulted in us setting up conservation through public health to keep the wildlife healthy and their habitat secure. If you have a chance to visit Bwindi, you visit us. This is actually the view from our field office. Very lucky to have the best view in the world from field office. And inside here, you not only have mountain gorillas, you also have chimpanzees, which are not habituated. The Wildlife Authority made a decision that the chimps will be habituated in other national parks like Kibale, so that people don't just stay in one national park, they visit, and the benefits are spread all over the country. But in here, we also have elephants, and we have monkeys, about 4 or 5 species of monkeys. We also have over 300 species of birds and 200 species of butterflies. And so it's a really rich biodiversity. We have 3 integrated programs: wildlife conservation, community health, and alternative livelihoods. We found that alternative livelihoods was important to complement the other 2. And we started this program much more recently. The first 10 years, we mainly focused on integrating wildlife health and community health, and later on added alternative livelihoods. So in the wildlife health program, we trained the gorilla guardians, the human gorilla conflict team that we helped to create so early on in the 90s, the late 90s. And they had they had gorillas like this one back to the park, and they monitor their health when they're in community land, and collect fecal samples when they're in community land, a time when they're most likely to pick up diseases from people. The rangers are trained to regularly collect samples from the gorilla night nests inside the park. Gorillas build a nest every night, and in the morning when they get up to leave the nest, they defecate in it. And this enables us to collect non-invasive fecal samples from the gorillas, which is much better than invasive samples. And so it's now become a regular activity. And these are analyzed at our Gorilla Health and Community Conservation Center at Bwindi, which was built with support from Trust. And these are 2 students. One is from University of London, where I went. The other one's from University of Dublin. They're looking at entamoeba coli and stress hormones in the gorillas. And they're being trained by Stephen Rubanga, our other founder member, who's a vet technician. And actually, by looking at these investigations where we look at disease in the gorillas, people, and the livestock, we're able to monitor and evaluate our community health programs to see whether, as community health is improving, is gorilla health improving. And I'll talk a little bit more about our community health programs. It started off with education. I actually started doing this work when I was still working for the government. In my last year, everyone was saying that, you know, the gorillas are not only exposed to dirty clothing when they go to people's gardens to pick up scabies, but people openly defecate, they don't cover their rubbish heaps, they're generally unhygienic. And they all turned to me, because I was the only vet in the whole organization at the time, to do this, to start doing health education programs. So, of course, in vet school, you're also trained to do veterinary public health, which is very similar to human public health. So this was a turning point in my life. I got a designer to design these. I can't draw to save my life, but I explained what I wanted, and he did a really nice design. And we went to the communities, gave them these brochures. We talked to about 1,000 people in 8 villages. And it was a very interesting experience for me, because I told them what the problem was, and I was about to tell them the solution. And the community conservation ranger and warden and district health assistants touched my arm and said, let them come up with a solution. And they came up with much better solutions than what I was going to propose, much more varied, because they understood their situation. And some of the things they said were, we want health services brought closer. I never realized that they don't actually have health services close by. Another thing that they also said was they wanted to strengthen the human gorilla conflict team that has gorillas back when they come out, give them gumboots, raincoats during this time. And they also mentioned that they really need us to continue this health education. And a lot of this is what we use to set up the NGO. And what we do is we translated this kind of material onto a flip chart for behavior change communication, working closely with the public health community, who are very good at behavior change. And this lady called Hope was giving a talk to her community. And this is helping to really uplift the women in the community, which was an unintended outcome, but it's really important. And she's able to convince them about why it's important to be healthy and hygienic, why it's important to have the number of children you can manage, And this really helps things to work out, because on this flip chart, you have the good family and the bad family. And the family that does all things wrong, they have too many kids, like this one, only half of them are going to school, the other half are staying behind to chase wildlife from the garden. And when the gorillas come out, they try and herd them back, chase them themselves, their injuries. And eventually the boy has teenage pregnancy, impregnates somebody, they have teenage pregnancies, they get caught when they go into the park to poach. Everything bad happens in that family and children die prematurely. Whereas in this other family, they have it that, like, they call out they have 4 children. They make sure they all go to school. They call out the human gorilla conflict resolution team, and everything works out really well for this family. And they graduate, the boy becomes a ranger, the girl becomes a nurse. It's all to do with having manageable family sizes, where you can give them proper healthcare, proper education, and you break the poverty cycle, and there's less dependence on the forest to meet their basic needs. So that's really helped to change behavior. And we found that the most popular contraceptive was Depo-Provera, because the 3-monthly injection meant that they don't have to take pills every day, and they can just go to the hospital and get it. But then the hospitals were overworked with so many sick children. So we trained some of our volunteers to administer it in the comfort of their homes. And this really increased the level of family planning. Eventually, Family Health International scaled it up all over the country, became a national policy and a regional policy when they went to Kenya. And I was excited that we were part of that research to policy engagement, because we were their 5th pilot study that they used, and all of us together came up with very good results, which changed national and regional policy. So currently we have 270 village health and conservation teams who are really community health workers trained to do conservation work. In Uganda, they call them VHTs, so we added the C. And they're currently working in 44 villages, and they promote good hygiene and sanitation, good health-seeking behavior, voluntary family planning. This particular family, all of them are from the same family. They're almost all the same age. They promote good nutrition, sustainable agriculture. They report homes visited by gorillas so that the gorilla guardians come and herd them back. There's a heightened awareness on zoonotic disease transmission. Also, there's a danger. We tell them not to eat bushmeat because they can also get zoonotic diseases, as much as they can also give them to the gorillas. And we talk a lot about the importance of preserving the forest and ecotourism. They tell people how they can benefit from the tourism revenue sharing, where they have to write a proposal to access those funds. Because $10 from every permit and 20% of the park entry fee has to go to the local communities. We are sustaining them through group livestock projects, which meant that we've not had dropouts since we started the program in 2007. And we are advocating with the Ministry of Health to do it all over the country where they have VHTs, to give them group income generating projects, because it's really helped to keep things going. And we also train community animal health workers. We call them community conservation animal health workers. Here we're doing a study in Giardia and Cryptosporidia. And this vet student from University of California, Davis, really got involved in taking samples from the gorilla nightmares, the cattle, the people, training them. He really enjoyed his experience, and he managed to get the company to give a donation of these fecal antigen ELISA kits. And so it was a really great partnership. And we published this paper later on. It's called Ryan Sadler. We published this paper together with the Bindi Community Hospital. And what we found in this study was that the Giardia had gone down in the gorillas, but it was still high in the people, and it was high in the infants who were sick at the hospital. Many of them who had diarrhea had a higher prevalence of Giardia. It was quite high in the livestock, but it had gone down in the gorillas. And we feel that it had gone down because of the improved hygiene in the homes that they went to. Crypto was still there. And what we did is we just recruited more village health and conservation teams in those villages that had the worst hygiene indicators. So this was something that we're really pleased to show, that how by improving one thing, another thing ends up improving. And we're pleased that the mountain gorilla population has grown in the past 25 years, and we're proud to have been contributed to its growth together with other NGOs, the government, the researchers. Everyone has played a role in this. And it's really great. This has then taken the mountain gorillas off the critically endangered to endangered list, even if there's just 1,000 individuals, just over 1,000. But all the rest of the other 3 gorilla subspecies, Eastern Lowland, Western Lowland, and Cross River, are going down in number, even if the Western Lowland and Eastern Lowland are much more in number, but the numbers are going down. And maybe tourism has played a role, but the lack of community benefits, I think, in these other places has contributed to the populations going down. And I think the fact that there's much more community engagement, improved veterinary care, tourism, all of that has really helped to make a difference. Gorillas, we find that gorillas are better protected in community land. We've contributed to that. There's much more increase in hand washing stations so that there's less people who are sick. There's much less open defecation. There's less scabies outbreaks. We've had 2 scabies outbreaks, and when we started the NGO, we haven't had any, much less giardia. Family planning increased from less than the national average to above the national average. And women are more involved in conservation and men in family planning, which is a great outcome, which we're very pleased about. So we are part of the PHE advocacy in Uganda, advocating for population health and environment approaches. And we published policy brief with the Uganda Poverty and Conservation Learning Group based on research that was conducted by Oxford University to see whether the health investments CTPH has made have resulted in conservation and sustainable development outcomes. And they were able to show us how we could improve on what we're doing. So now all the village health teams, all the community health workers are now engaged in conservation. Before we used to get the most active ones, but they were overworked. And through their research, we're able to see that the homes that were most visited had very good indicators and the ones that were least visited didn't. And now we needed to visit all of them. And we're also advocating for all VHTs to become VHCTs. And so over here, we're inviting people from DRC and Mount Elgon to see our approach at our Gorilla Health Center. We're doing some work in the Virunga National Park where it's much worse for the communities. There are many more temporary houses like this one. This is actually a kitchen, believe it or not. And one thing I can say that tourism has helped a lot in Uganda and Rwanda, because the number of temporary homes like these have really reduced and many more of them are more like permanent homes, which is great. Gorilla tourism has played a significant role in this, I have to say. I have to say tourism is maybe a necessary evil, but it has to be done very carefully. And when you come, they tell you have to be 7 meters. This was before COVID, you have to be 7 meters distance. This study was done together with a student from the University of Kent, where she asked tourists whether they're willing to wear masks and what they think of the distance. And here they're watching the gorillas at the proper distance. But when we conducted research with a student from Ohio University, she found that 60% of the time, the people broke the rules, and 40% of the time, the gorillas broke the rules, in spite of the people being told all the time why they shouldn't get close. But these days, people are so excited, gorillas are so habituated, and unfortunately, this situation happened too often. So we got really scared when the pandemic started all over the world, and eventually got to Uganda. It got to Uganda in March 2020, just in time for us holding a ranger training workshop on everyone having to wear masks. We got together with the Wildlife Authority, training their rangers and all these NGOs to carry out this training. And now everyone has to wear masks when they visit the gorillas. Like anyone, whether it's a ranger, tracker, whether or not you're vaccinated, you have to wear masks. And that was one big thing that we're really pleased that Alison's research and Annalisa's research showed progressively people are willing to wear masks. And when the pandemic came along, it was easy for the government to say this has to be in place. And also the distance increased from 7 to 10 meters, and many other regulations came up. It's part of IUCN and Gorilla Pathology Specialist Group, but they have to take your temperature before you go in order to detect subclinical illness, whereas before they didn't need it to just show, you just needed to look sick and then they wouldn't let you go up. But now you have to also check with the temperature. And the gorillas are fine with people wearing masks. They don't really mind it, and it's safer for them. And actually the tourists who are now breaking the rules are demanding that they're not going to make the gorillas and chimps sick from COVID. And that is helping. Some of them are really becoming conscious travelers. And so we developed this brochure for the local communities with support from ACAS Foundation and Solidaridad. And actually it was a human brochure, but we added gorillas, and the posters are put up everywhere where they can call the 2 wardens in case gorillas get into their homes, and the Hugo members had them back wearing masks. We made sure that we trained them to put on masks as they're herding back the gorillas. And everyone's now fully conscious about the COVID issue. The village health and conservation teams have trained people to wash their hands. The hand washing stations went up even more. And also at the same time, there are all having to wear masks or social distancing. And this was the time when they were only allowing gatherings of 5 people at a time. And because our NGOs doing One Health work were considered essential workers, and we were allowed to work. So we've actually worked extremely hard during COVID. We haven't had a break because we had to make sure the gorillas are kept safe. When the pandemic arrived, the surgical masks ran out in Uganda. So we got a local entrepreneur, Right for a Woman, to make these masks. And it's really good because it kept some people in business. And so they didn't have to suffer from lack of tourism, which really helped. We started the Gorilla Conservation Coffee Social Enterprise as part of our alternative livelihoods. And this photo was taken just before COVID. They were ordering from us every week. These are farmers we meet as we're going to track gorillas, and we give them above market price for good coffee, and it reduces their dependence on the forest for food and fuel wood. This coffee is now being sold because the tourists disappeared during COVID. We looked for markets outside Uganda, and we got one in UK, Maniro Beans. This is Vicky from Maniro Beans. The US market picked up in January 2021 after our distributor ran out of coffee in March 2020. But when flights could now fly to US, he's really picked up. People are really buying coffee whenever they feel we want to protect the gorillas, even if you can't visit because of lockdowns and whatever's happening, they can buy the coffee and protect the gorillas. And so this is really helping. But unfortunately, in June 2020, this gorilla was killed by a hungry bushmeat poacher because the moment tourism disappeared overnight, there was no income in the community and people went back to poach because they were using the money from tourism to buy food. Very sad, Rafiki was killed. This poacher was given 11 years in jail, which is the longest any poacher has ever got in jail for killing wildlife. But people like that are so poor, and what do you do about them? When we checked on Rafiki 1 month later, he was really, when we checked on his group, they had already split up, and it was now being headed by the second oldest male, Ramutwe, wasn't yet a silverback. But this potter was wearing a mask saying in memory of Rafiki, because most community members were very sad that Rafiki had been killed. They know that he's really helping to lift them out of poverty, and he hadn't had a job for 6 months. So we gave him that first job when we went to check on Rafiki. So we decided to provide fast-growing seedlings to the most vulnerable households, such as the poacher's wife, who's very poor, 22 years old with 3 kids under the age of 3. And people like her and others are now being deterred from poaching, not only by the fines, but also because we're giving them food and they're able to eat in the absence of tourism. And we've told them that this is for now and for later. When tourism comes back, keep digging, because they used to just farm before tourism began. And they abandoned it because it was much more lucrative to carry someone's luggage to the gorillas. And so now they all know that they have to just be continuing to grow food in their garden. And when tourism comes back, the money from tourism can just help to support other needs. As we speak now, COVID has reached quite a number of, millions of people, obviously, and captive Loram gorillas contracted COVID in America and Czechoslovakia, lions, tigers, hippos, and then farmed mink. And from the mink, it's even jumped back from the mink back to the handlers, which is even worse, and wild deer in America. So COVID has really jumped, back and forth. And that's something that we're all very concerned about. We don't actually know, it hasn't yet been proven where it came from, but all the other coronaviruses, SARS and MERS, came from animals. So it's strongly suspected that SARS-CoV-2 did as well, but it's still being proven. And during this, in the second wave, the Delta variant, where people are actually dying in Uganda as well. Uganda wasn't as badly affected as US and UK, but with the Delta variant, a lot of people died. Most people who got it died, and we have much less hospitals, much less oxygen. So the Ministry of Health called on all NGOs who are sitting on the COVID-19 task force to develop village COVID task forces so that they prevent mild cases becoming severe cases. So we're training people to administer home-based care, as in this diagram here. And on it, we also have rangers, porters, because when they're on this committee, the rangers know which homes have COVID and make sure gorillas don't go there. Porters are also part of it. They are not allowed to carry tourist luggage to the gorillas if they have COVID. And so this has really helped to reduce COVID in the community and COVID spreading to the gorillas. This particular gorilla This just happened last month. He was in community land again, eating, bark and other things in community land. And as long as such things like this happen, we really need to make sure that the communities continue to be healthy and there's less diseases like COVID and others that can make them sick. So we're finding that we're also doing a lot of vaccinations, promotion in the communities. Some people there was a bit of vaccination reluctance, just like in other places all over the world. Unfortunately, they got WhatsApp messages, and America, actually, I have to admit, they would get messages from, anti-vaxxers in America, and then it spreads all over the world like wildfire. So, so it even got to Uganda, and there were anti-vaxxers in Uganda. But however, we really advocated to them, and we advocated the Ministry of Health that the park staff are the first people to be vaccinated, amongst the health workers, teachers, security personnel, and we succeeded. Anyone working with great apes, we were all in the priority group. My team were the first to be vaccinated in March 2020. And the tourists had already expressed that they don't want to meet community members because they don't want to meet people who are not vaccinated. So they all knew that if they want to get out of this whole COVID crisis, they need to get vaccinated. We published a paper with Fabian on vaccinating people in biodiversity hotspots to protect people and wildlife from each other. And so I think there's been a lot of that. And the first people to get vaccinated were the people in the tourism industry. We conducted a study with USAID group, USAID funded projects to see how to increase COVID vaccination uptake in hard to reach communities in Uganda. This was actually done in Queen Elizabeth National Park. But when they saw our staff members getting vaccinated, the community members got encouraged to be vaccinated because most of our staff are from the community. We developed a policy brief for all the 21 countries in Africa with great apes, when great apes naturally occur, and it's going to be launched at the very first IUCN Africa Protected Area Conference in July 2022. And in this policy brief, we're emphasizing that people have to carry out responsible tourism to the great apes, put on masks, maintain a distance, understand that it's not only about the money, but it's about conserving the great apes so that they can be able to provide a revenue that keeps people out of poverty for a very long time, so that they don't end up dying of deadly diseases because tourists want to get selfies, they're becoming careless. So 13 of these countries have tourism at 33 sites, and Uganda has the most tourism, and we're advocating to government, donors, and tour operators. And we've also carried out an education campaign with the University of Exeter, Robert Koch Institute, Bristol Zoo, and it's funded by Darwin Initiative. And if you open this website, you'll be able to see all that we're doing on there. And it's mainly focused towards travelers, that they know that when they come, they have to be responsible travelers. They should be part of the solution, not part of the problem. They should be part of the total solution. But another part we're advocating in the policy brief is that they should visit communities. They should give, support communities, because we've seen how communities really need this money in order to keep out of the park and reduce poaching. In Rwanda, they found that the respiratory diseases in the mountain gorillas reduced due to mask wearing. And even before the pandemic in Ivory Coast, it was also found that respiratory diseases in the chimpanzees reduced when they instituted mask wearing. So this is something we want to continue way after the pandemic. Mask wearing should be the new norm. I'm writing a book about my conservation journey that we've developed, which has been influenced by a One Health approach, and it's coming out in October this year. And I hope you get a chance to read it. It's already been advertised in UK and US. I'm really excited that Dr. Jane Goodall has written the foreword as well. She's become a very great advocate of One Health approaches, which is fantastic. Well, thank you very much, everybody. And for more information, visit our website and follow us on social media.
All right, thank you so much. I thought this was really great because we've gotten a lot of presentations about One Health research and really cool research that's going on. And this was a really great way to see how that research can be implemented within a community as well as through policy. So I thought that was really great. And we want to open up the floor to any questions. You can put it in the chat, or feel free to, I believe you're unable to mute yourself now and ask.
Mhm.
Well, I'll say one, oh, we actually have a question. Oh, I will post the social media links in just a second also. So one question I had is, one thing we get a lot is like the simple question of why One Health? And I feel like your presentation is a very detailed example of why One Health through so many different things like family planning and guerrilla health and environmental health and so much all interlinked together. But for example, if someone from a policymaker or someone from the general public was just like, why One Health, and wanted a sort of brief, easily understandable answer, how would you answer that?
I would say that why One Health? Because everything is interconnected. You can't have healthy people without having healthy animals, and you can't have healthy animals without having healthy people and a healthy environment. And the pandemic has shown us how much everything is interrelated. And we've seen it so many times. And now monkeypox is the latest, which has come up. So One Health is so important, and everything, sectors have all been individual, like conservation sector has been alone, the public health sector has been alone, the animal sector, the human sector, and yet they're all interrelated. They all affect each other. And a decision you make in one affects all the others. So we have to be very, very careful and make sure that, you can't just, if you ignore the animals, they're going to keep making the people sick. If you ignore the people, they could continue to make the animals sick, as in the case of Windy and other places where great apes are found. And the environment comes in because you need to have like enough trees, enough of everything, very little. We have to minimize on deforestation, habitat encroachment, anything that takes everything out of balance has to be minimized in order for us to have a planet in balance. So One Health is a very holistic approach. It's sometimes hard to measure impact with One Health. One little aspect of One Health and think maybe it's not so important anymore, but actually it is. There's a lot more to One Health. There's a zoonotic disease component, there's the family planning, having manageable sizes, there's the climate aspect to it. There's so many aspects to One Health, and it's just that holistic approach is needed to address everything in a holistic way.
Hey, I just want to make one comment, and I'm Deb Miller. I'm the director of the One Health Initiative here. Wonderful, wonderful talk. I mean, as you know, we've been trying to get you on your calendar for a very long time now. So we really appreciate you taking the time to do this because we know you're in high demand. But yes, so the importance of One Health, and I think what I really, really appreciate from your talk is how you really brought out that it's not just the experts getting together and participating in solving these wicked problems, but it's actually getting everybody. So getting the people within the community itself to actually participate in solving these problems. Because if you don't have the public working with you, you just don't make much headway. And I love how you, I think it was your brochures, or you were trying to come up with possible solutions to a problem, and the solutions were better coming from the people who were actually living it. So that's really awesome.
Thank you. It was a very humbling for me as a vet, because we're used to solving people's problems, and so but it was great for me. I think it was really good for me. I matured after that experience. I became more mature.
I can relate. Let's see.
I also found it very interesting and important how, obviously it's a very sad and bad thing that the poacher killed the gorilla, but instead of just focusing on, well, he's a bad person, he did this, the sort of reason behind the crime was addressed, and we're like, well, these people are hungry and that's why they're doing it. And so you went out and basically said, well, here's some food so that you don't have to poach it, versus just saying, well, don't poach it because that's bad. So I thought that was very interesting and something I hadn't really heard before.
Thank you. Yeah, because we just looked around and we're like, you know, there in Queen Elizabeth National Park, which is not far from Windy, people were also killing lions for and it's like, so, some of the people who've been doing research for many years around Windy, decades, said the same kind of person who will kill a lion, will kill a gorilla, will kill this and that when they're in the park. And you just need to, the long-term solution is to find an alternative for them. And we're pleased that with the Gorilla Conservation Coffee, some of those are reform poachers. You know, we just found, and when we gave out distributed the seedlings, we gave a very short questionnaire to everyone who we gave seedlings to, asking them, part of the questions were, why are people poaching? And they said people are poaching because they're hungry. And, you know, because the economy had gone down, even the borders were closed with DRC where they plant their crops, and there's no tourism. So at least it gave us an indicator. It made us happy that we're actually doing the best thing for them. And yeah, so it's going forward. Actually, food security was never in the CTPH model, but now we've adopted it.
So this is Becky Hardeman. I have a question, if that's okay. Can you hear me?
Yes, we can.
Okay, great. Yeah, you brought up a good point on the other species. Have you noticed any other effects on other populations, either through reduced poaching or just ecosystem effects where the populations are healthier of any other species?
Yes, the chimpanzees, I think I would say, because they're just like gorillas, and it's definitely made a difference. You know, as human health is improving, or more measures are being put for gorillas and chimps, you know, for people visiting gorillas and chimps or coming into close contact, things are improving for them. But we've also tested this model in a non-great ape habitat, like at Mount Elgon, where you don't have great apes, but there's a lot of human, I would say, conflict between people and the park management. Because, you know, people want to graze in the park, they don't see, in such areas, there's no tourism, they don't see the benefits of even staying outside the park. They want to plant crops, they want to graze. And when we started this One Health program of empowering village health and conservation teams, people started planting trees, they started adopting family planning, because we show them that we care about them. We don't only care about the forest and the wildlife, we also care about their health. And healthcare is a basic human right, actually, not just a human need. And so by improving people's health, you improve their attitudes to conservation, which is another reason why we set up conservation through public health. I wanted to test that theory, and it seems to be working. And so this One Health approach can also work in areas where the threat of zoonotic disease transmission is not so high. But it is high still, though, directly from animals to people, because, you know, when people eat bushmeat, they're more likely to get sick. Although some people don't believe it until it happens, but it does happen. We've had anthrax outbreaks in Queen Elizabeth National Park. In 2004, over 300 hippos died of anthrax, and over 200 people got sick by eating hippo meat of dead hippo, and 6 people died. And the only way we got all this information is we got together the district vet officer, the district medical officer, and the wildlife authority in one room, and we held a workshop with them, and they admitted what was happening. And so when another outbreak occurred in 2010, 2011, we joined the National Disease Task Force for the Ministry of Health and Agriculture, and our main role was social mobilization. We carried out some participatory epidemiology to find out why people eat such meat. And then they said they preferred person-to-person contact. So we created another group of community conservation animal health workers. And in that particular outbreak, 100 hippos died because the Wildlife Authority buried them very quickly. Now we understood what to do. And then our community volunteers went out and talked about why you shouldn't eat meat from an unknown source, why you shouldn't eat animals that you found dead, you don't know what they died of, why you shouldn't eat bushmeat. And so this time around, hardly anyone got sick and nobody died. And the cattle were vaccinated in time with anthrax. So it showed how a real One Health approach can work, because we all got together and ever since we joined that task force, my husband actually helped with a disease communication platform so people could get messages on their phone about anthrax in the local language, what to do if you see your animals, you know, bleeding from orifices. So that also really helped a lot. And later on, we joined the same task force when there were Ebola outbreaks, Marburg outbreaks, COVID. So it's another area where we do a lot of our work to promote the One Health approach. And we're always advising the One Health, the National One Health platform. And we're about to start a project with the Uganda Virus Research Institute, which is the Ministry of Health branch that does research, and the Ministry of Agriculture and the Uganda Wildlife Authority, in order to look at different diseases in all the landscapes, different national parks, Bwindi and a few others, trying to use a One Health approach and get it really institutionalized in all these places.
Wow, that is really cool. And yeah, your work's awesome. And thanks so much for giving the talk. Thank you.
Thank you. I think somebody asked a question about areas where locusts can hunt without it being considered poaching. Yes, they can do it outside the protected areas, so outside the national parks and outside the wildlife reserves, except that endangered species are protected by the government. So if you happen to find like a gorilla or a lion or chimpanzee outside a protected area and you hunt it or poach it, that's illegal. But then if it's a species that's not protected, like duikers, bush pigs, that are not considered to be so protected, you can eat them, but it's not good for you anyway. So yeah, but there is a move for people to start protecting wildlife outside protected areas as private landowners or community members who have wildlife on their land and also benefit from it, because that will help all the wildlife populations to grow. It's worked really well in Kenya. It's called conservancies, and they're just beginning in Uganda as well. So in fact, this research we're doing with all these different groups, consortium, is in the conservancies, which are beginning to come up. And we welcome students actually to come and conduct research with us. We gave a few examples of some, and we have certain research priorities. I didn't put them up this time, but I think from the presentation, you kind of got an idea of our research priorities. And yes, we welcome students to come and conduct research with us.
That's awesome, because I think our Associate Dean for students from the vet school was listening to your presentation. So hopefully that will get passed along, but we'll make sure that gets passed along anyway.
Fantastic. Yeah, we've had students from different disciplines, vets, public health, conservation, and different disciplines, and they're all welcome. Yeah, there's a lot to do to learn about how the One Health approach works, if it works, how well it works, and how we can improve on it. And it's great to work with students. I started out like that as a student in conservation. So
Awesome. Okay, Marcy.
Can I ask a quick question? Dr. Gladys, it's nice to see you. I'm sure you don't remember me. I was a student at NC State when you were a resident. Long ago.
Oh, wow.
Long ago. But so I'm actually here at University of Tennessee now, and we'll be starting next month trying to build some of our international opportunities for our students. So I would love to reach out to you. And I don't know if it's best to reach out to you or someone else with your organization. You
can reach out to me, but copy Hani, who's been communicating with you.
Okay.
Yes, no, would love it. So you're now the Dean of Students?
Yes, Dr. Lane, she's on here as well. Yeah, we work together, and so we're trying to build together opportunities for our students to go leave the country.
Okay, no, yeah. Definitely.
There's India.
Would love to host students, and it's so great you're at NC State. Actually, NC, North Carolina Zoo gave us our very first funding to set up the nonprofit.
Oh, cool.
$6,000 of unrestricted funding. We didn't realize at the time that it's very difficult to get unrestricted funding. But
yeah, do whatever you want with it. Yeah, it's rare.
Yeah.
Awesome. Yeah, well, I'll definitely be in touch then.
Yeah, we used it to hold a planning workshop with stakeholders to see what they think we should be doing in this new nonprofit. And that was very, very useful.
Awesome. Great. Super. Yeah, I'll be in touch though.
Yes, thanks very much. And anybody else that's on the call in other departments, be sure to reach out to Marcy. We absolutely have students and applicants that are very interested in international experiences and conservation experiences in One Health. And I'm looking forward to seeing that grow with Dr. Sousa. And we'll keep working on the funding on our side as well. But it is very exciting. And we just learned this week that one way to get our students' attention is to put an international experience in the subject line of an email, and they will actually open it. So.
I'm sure people want to travel as well after lockdown, and they want to get out and see the world. Well, that's great. And we'll let you know when the book comes out. Of course, North Carolina is mentioned in a big way, because that's where we, the idea for the NGO came up. And hopefully it's coming out this October. I'm busy working on it, trying to find time to work on it, in spite, in the middle of everything that's happening. But
That's awesome. Yeah, if we can pre-order, that would be great too. That probably gives you more stress to get it done. But yes,
yeah,
One Health, One
Mhm.
Health is becoming, I really get excited, and I tell people that students want it. They want to learn what it's like to take a One Health approach, and they want that experience. And a lot of students are actually seeking this out when they're considering what institutions to go to. So
it's great to have a One Health initiative at the University of Tennessee. There's a vet who used to work with Mountain Gorilla Vet Project, Dr. Jonathan Sleeman. Remember, he was and I think he taught at Tennessee, or did he do his residency there? I can't remember, but
He was a resident here.
Yes, he used to talk about Tennessee a lot. He trained me, and I used to go with him at the beginning when I was starting out at the Wildlife Authority to that gorillas, and he taught me a lot actually about gorilla health and gorilla anesthesia, and we're still in touch.
very nice. Okay, I think that our time is up, sadly. So thank you again.
Uganda, one day, you and the students, and yeah. And stay safe and healthy, everyone.
Yes, same to you.